Welcome to the Ultimate Dental Podcast, the place where you can learn how to create a dental practice and a business life that you love. Listen in with Dr. David Moffet as he interviews successful entrepreneurs and successful business people and successful dentists as they share their business successes, their stories, and their breakthrough ideas. Sharing pearls of wisdom that you can take back to your practice and implement immediately so that you can have that great practice with more patients, higher profits, and less stress. This is the podcast where great dental practices meet with successful business processes. Thanks for tuning in to the Ultimate Dental Podcast, the podcast where thought leaders, industry experts, and thriving practice owners reveal their very best tips, tools, and strategies that will help you to grow your dental practice faster. Now, here's your host, Dr. David Moffet.
Hi, everybody, and welcome to today's episode of the Ultimate Dental Podcast. I'm your host, Dr. David Moffet. I'm in Burrowang in New South Wales, and it's lunchtime on Friday. And for my guest, Max Ganhewa, he's in Melbourne, same time zone, just a different state, not far away, an hour's flight away. Max, welcome to the Ultimate Dental Podcast.
Thank you so much for having me, David. Excited to be here.
Good to have you. We've been chatting for several months. I came across some information early in the year when you were looking at your company CoTreat, your business CoTreat, was helping dentists to identify caries more easily and share that information with their patients. But since then, and just recently, we've crossed paths again because you're working now in the space of helping dentists to help their patients get straighter teeth using aligners and to also restore their occlusion where they've got missing teeth with implants. So, Max, you're a dentist, firstly, and then a techie after that. Sometimes there's techies who actually don't even become dentists and think they know how to be dentists. How did you stumble from dentistry into the tech world, or was that just always something that you did at nighttime and dentistry was something you did at the daytime? How did that happen?
It's definitely not something I stumbled on. I don't think I, imagine running a tech company, when I first graduated as a dentist, 2007, or building a practice in 2010, I thought my career path was pretty linear and set for the rest of my life, right? Like as we all do when we graduate and start businesses. But probably like 5 years into having my practice, I think I started to observe problems, both in terms of patient care and also in terms of running a business. So we're first and foremost, we're health professionals, right? Like patient outcomes first, making sure patient treatment diagnoses, treatment plans, and the treatment itself is really high quality. I think just seeing variations in that due to sometimes inexperience or various things, right? Like we're all at different stages of our dental journey. So, as a practice owner, seeing the different standards of care and the subjectivity of the diagnoses, if the patient saw practitioner A, they would come up with, walk out with a different treatment plan as opposed to practitioner B or myself. And the vast majority of the time, all these are valid, right? Like they're, in this sort of swim between the flags, they're all valid. But I think there are instances where sometimes there are misdiagnoses where quickly looking through a radiograph, you've missed a periapical lesion or caries or whatever, right? Like sometimes there's misdiagnoses. I think on the very rare occasion there's possibly overtreatment. I don't think that's very much at all looking at the data. And I think as dentists we are, as a whole, the vast majority act well. But anyway, that's sort of what hooked me to the problem, David. Seeing the subjectivity of diagnosis and treatment planning, and then sort of seeing the impacts of that on my business, in terms of reputation, as well as evidence-based opportunities, which is patients got malocclusions or crowding or missing teeth or heavily filled posterior teeth that need indirect restorations. But for whatever reason, the patient hasn't been informed of this. They haven't been told the clinical consequences of, not having the treatment. So it was kind of frustrating as a business owner because we know how expensive and difficult it is to acquire new patients. To even get them back for recalls is difficult. But when they're in that chair, like for me, it was incredibly frustrating. And now we're seeing this sort of, um, and I think like co-treat success is, I think this problem resonates with so many practice owners where they do want to give patients all their options and give them a chance to buy that treatment. So yeah, essentially why does co-treat exist? It was this like patient care first, but also business outcomes. Those are the two things that hooked me. That took me to Melbourne Uni for a little bit to do some research around, the decision making and the thought patterns that sometimes cause dentists to fall into these pitfalls. And then obviously the tech side of it is the solution to that problem, which is computer vision and other agentic algorithms to help, support the dentist to essentially look after their patient better and more consistently.
So let me get this right. You went from the dental side,
Yeah.
practitioner, you didn't go to the tech first. You went to the mindset, the psychology of decision making and being able to communicate better with your patients so that they understand what you're trying to do for them. And then you realize that tech was going to help in that process. Wow, that's interesting, because I'm listening to this knowing that I was a dentist all my life, 35 years on the tools, and I learned persuasive sales techniques, because ultimately that's what we're doing, is we're helping the patient to get the treatment that they want, as opposed to spend that money on a holiday or something else, or to think that they can get by without the treatment. So you're right. They need to understand the consequence of not treating. And I often tell my clients that even just with a clean, patients just think that what goes on in their mouth is like cleaning the garage. I can come back next month and it's pretty much the same. And it's not. This is a hostile environment. And I don't think any dentist graduates with a degree that teaches them how to communicate, that the only time they tell you to paint a worse picture is when you're taking out a wisdom tooth. Isn't that the truth? They just say, you got to tell them how bad it's going to be, because if it's good, they think you're a wonderful surgeon. And if it's bad, you were right. Well, it's pretty bad in here most of the time. So I like you've done it. Sorry, and in the background, of course, I've given birth, or Jane gave birth to a software engineer. So I've got a techie in the family, and it's funny looking at him and saying, hey, why don't you do something like this? And he goes, no, I don't want to do that. So he has his divisions of what he's looking at in the tech world, and helping healthcare practitioners in the tech world is not something that he wants to do.
Yeah.
So that's quite funny. So I love that you've grabbed this with both hands, and that you've worked out the inefficiencies of face-to-face presentation from doctor to patient, and it's crazy. Even I saw an eye surgeon who was like this. There was like, go away and think about it. And I said, no, just book me in. I'm ready to have the cataract surgery done. Well, why do I need to think about it? But that's just how they did it. Really crazy.
Like what I've learned is like technology can support the dentist, but ultimately people buy from people, right? So that like human consultation, it is still absolutely by far the most important thing. The technology can sort of support that and sort of shape the patient's awareness and thinking. So they can sometimes ask, hey, am I suitable for orthodontics? Or what can I do about this missing tooth? So I think the technology can build patient awareness, but ultimately no technology can, support a human conversation to build trust and empathy, and then the clinical consequences to get the case accepted. So I think it very much has to work in unison.
Well, I think with the technology, a picture's worth 1,000 words. It's an old phrase. So it's probably pre-cliche. It's just the truth. If you can show somebody a picture, it saves you doing a lot of talk, especially in orthodontics. Will my teeth look better straight? Let me show you an image of what they're going to be like. What's going to happen with this gap? You can talk all the numbers. I used to use the numbers. We extract one molar, the top one's useless. You've only got another one on that side, so you're down to 75% chewing. So you've got to start your meal earlier if you want to finish on time with all your friends. And that's the sad stories. When you hear people say, I can't eat as fast as my friends, so we don't even go out to dinner anymore. Those stories really help people say, I need to look after my back teeth, as opposed to, you wouldn't do it with your fingers or your eyes. I've got 9 more. I can have one chopped off. But with teeth, they say, oh, yeah, that's okay. Yeah, just rip it out, doc. So it's getting over that sort of thing. So being able to visually show the consequences now with the technology that wasn't around when I graduated. Nobody was using
So
computers in
to
dentistry.
to that point, David, like one thing CodeTrade does is we can actually send the patient information packs, including their own images, right? You can include a scan, for example, as well, so the patient can spin this thing around in 3D. And we're always flabbergasted by like how much patients engage with their own data. Like they come back to this thing sometimes over 3 sessions, spending 5-10 minutes sometimes a session. They're zooming in on their photos because we can track their behavior, right? Just like Facebook or websites can track how long a user spends on their website. We can pretty much track how long a patient spends with their information pack. And to your point, photos and scans and images, that's what they spend the most time on. They'll glance through the written advice, they'll scroll through it really fast, spend a ton of time on the photos and the scan, and then they'll sort of look at the quote if a quote's there. Yeah, so it's kind of fascinating to sort of see the cogs sticking over while they're engaging with their information.
Well, the important thing from that, Max, is this working to help the patients accept and complete the treatment that they need? Is it helping improve those?
Absolutely. So I think like what we have to do is like sort of divide the basics where the patient can say yes straight away, right? Like let's say it's a filling or a root canal or just something. Essentially, the dentist says, we need to do this. This is for your health benefit. And the vast majority of the time, the patient will say yes. But I think what really needs like proper marketing and like proper, like essentially a sales funnel and sales strategy is the higher value treatments. So orthodontics, implants, full mouth rehabs. These are the treatment types that like really move the needle for the business, right? But there's a lot of patients that just need time to think about this. To your point, like the cataract surgeries, like I'm not sure what the monetary cost of that was, but I just think, especially in a cost of living crisis, and so many like other services around that can potentially provide you the service, and Google and now OpenAI to do a whole bunch of research. I think increasingly patients, will need more nurturing and a really high customer experience to convert these high value cases. So to answer your question, essentially what we do is we empower the patient in a controlled way, if that makes sense, like, so they don't go on Google or OpenAI and just look for competitors, go for second, opinions everywhere. We try to make you the practitioner, the trusted source for that data. And we do that by empowering the patient with their own images, with their own x-rays, as well as like, proper content that the patient can engage with. And then obviously depending on their engagement, we sort of move them along from nurturing to patients engaged to consult booked to, again, engaged, treatment quoted, and then ultimately, they click on a button and they've accepted the treatment and hopefully paid for it. So very much for converting bigger cases, I think CodeTrade's a useful tool.
Yeah, well, I saw it in its infancy, I guess, when it was just looking at helping patients read black and white x-rays. And so, having color for the warnings, this decay is red, you've got to get this out because this is urgent, and green is not so urgent, just like traffic lights. But just like traffic lights, Max, there's always somebody who'll sit on a green when the light goes green, they sit there and they don't move.
Yep.
Green
Exactly.
means go. But it's 50 shades of grey reading an x-ray is really hard, and dentists can read it. But I still remember after my first colonoscopy, doctor showed me images and I'm going, it's all pink there, what am I looking at? You know what it is, I don't know what it is. And so often I'll think the same when the patients are looking at mouths. They don't, I think some of the worst photos of mouths are the ones with, sorry, Max, are the ones with facial hair attached to them, and the patients look, oh, gee, my beard looks really bad, as opposed to, well, what about your teeth? I'm just, get to the teeth area. So it's hard to get the focus right. So I like the fact that you can put it in their hands and they can zoom in, zoom out, and swivel around and look at the angles. And I guess you can probably put some little prompts in there, like, if they've got missing premolars for implants, you can say, well, when somebody looks at you from the side, swing it to 45 degrees and see that, and that should be, or was the way we used to sell 10 veneers instead of 6, because 6 was too narrow, and 10 was more
it's a better smell. Yeah. So I think like good framing is giving the patient like prevention advice, right? Like they come in for a checkup and a clean or just a filling or something. You give them their own data and then you really build trust. And this is genuinely good for the patient, which is give them, videos or advice on prevention. So you really signal that you care about the well-being, which hopefully we do. And then in addition to that, you can have a thing saying elective treatments available to you. Here's a video about an implant. Here's a video about a rehab, whatever the application is. And the AI can obviously help you detect what the opportunities are. We can start building this awareness. And I think for any purchasing cycle, it begins with awareness, right? Like if you don't know about something, you can't be interested in it, and then you're not going to buy it.
Yeah, it is important about raising that awareness. And of course, even before that, before being told by the dentist, it's important that they alert the practice too, especially like for a new patient or even an existing patient, any update in seeing any changes in your teeth or in your mouth or in your smile that you've got a question about. Because I'm of the vintage, I was one of 3 children. And of course, being the eldest, I was the one that was not chosen for orthodontics. My brother got orthodontics, my second child, and then my sister didn't, and she needed it as well. In fact, I ended up doing her ortho as an adult. But we were told, me and my sister, that crooked teeth is character. That child has character. Well, character is just a word used for parents who don't want to spend money on their kids having straight teeth, really. The reason people have straight teeth is because that's how God meant the teeth to be. That's why they're there. All 32 are meant to be in there. That's why in some races, 32 teeth fit in fine, and
Sure.
you never actually see those people with braces because their jaws are big enough. It's that education process of not saying. Again, I think that the dentists also need to get away from softening language. It's just a little crack, only a clean. It's just a clean. How many times do you ring up and say, "Oh, it's only a clean. I just need to change the appointment," as opposed to, "This is your 6-month checkup, and if you miss this, the next available will be in 6 months' time." And we need to get on to, because we are health practitioners ultimately, rather than treaters of disease. We should be actually promoting health as opposed to promoting cures. We should be preventing more, I think. And I'm seeing a lot of swing in that sort of way that dentists need to be working. Sure, I love how co-treat helps to get people back to health. It's easier to chew with more teeth. It's easier to march and run with 2 legs. It's the same philosophy. That's why we've got these teeth, and they're meant to be there to grind the food so that we don't end up with bowel cancer either. Is there a study between the link between missing teeth and incidence of bowel cancer? Because I think you'll find that the more teeth you've got missing, the more you're swallowing your food, the more your guts are having to try and dissolve the stuff, and it's festering in those diverticuli. But sometimes
no idea. It'd be interesting to look that up.
Well, yeah. Anyway, back to co-treat. Tell us about the results that you're seeing in the aligner space in terms of helping general dentists to, again, help their patients. Because patients will often sit there thinking, "Oh, I've got crooked teeth." You being a dentist, me being a dentist, we watch newsreaders, presenters all the time, and sports stars being interviewed and go, "Why aren't they getting their teeth straightened?" There's bottom teeth that look like this, like a mountain range, and they should be beautiful. And especially in the media, why do people not notice that themselves, or why do they think it's okay to have crooked teeth?
I mean, I think it's just a simple thing. You're always talking to other people, but you don't really speak to yourself. It's only like, I think in this like post-Zoom culture where all of a sudden the lower anteriors have become a thing, where I think people look in the mirror, they smile to themselves. They've always noticed the crowding in their upper teeth, but increasingly the crowding in the lower teeth is becoming more of a, what we call a pain point, where people are concerned by it. And that's an opportunity for us to, address it with hopefully pretty simple sequential aligners. Yeah, so in terms of orthodontics and co-treat, we have a massive data set now, right? Like now that we've got all these practices and dentists using us, when you aggregate all this data, some really interesting insights sort of appear. One thing we, always sort of promote is the fact that roughly 63% of your patient base, and obviously, depending on the practice demographic, like if you have an older demographic or younger, whatever it is, this is obviously going up and down. But as a rule of thumb, 63% of a patient base is suitable for pretty simple aligner cases. So this is like mild or moderate crowding or spacing, or like really basic malocclusions. So that's like, it's mind blowing how many patients that is, like every day you're going to get probably 6 or 7 patients tagged with orthodontic opportunities. And the thing is, the vast majority of these patients are just not aware. They've been coming in for their checkups and cleans for the last sort of 10 years or whatever it is. Now it's like all of a sudden we have to start communicating to them about something that they've never heard before. It's like, I've been coming here for 10 years. So it is a tricky thing to slowly communicate this and get their concerns and, tell them about the new technology and aligners and the improvements. You don't have to have braces anymore. Yeah. So I think like probably the first thing that CodeRead does for a practice is identify the raw opportunity. And it's often mind blowing and quite confronting, to be honest, as a practice owner, to know that you could have been making a heck of a lot more money if you started having these simple evidence-based conversations with patients. So I think that's the first thing, David, that sort of adds a lot of value is revealing this raw opportunity for aligner cases as well as implants.
Well, I think with aligners, Max, a lot of patients will think that it's just for cosmetic reasons. Crooked teeth are harder to clean, and in lower anteriors, bone loss is permanent. And it's difficult to clean. So having straighter teeth means less chance of the bone loss. I can still remember doing a fixed orthodontic braces case where when we put the wire on and started rotating the teeth, the two anteriors, as they turned, there were cavities. But because they were flat surfaces against flat surface, they had never been seen until those teeth were rotated. And it was like, heck, we've got to take the braces off and put a filling in there. It was really weird. But that, I think, is the important thing, is it also helps people to realize that it's not just for a cosmetic benefit on their bottom teeth. Sure, that's a bonus, but being able to keep your teeth longer and keep them cleaner longer. And even though we all know that our teeth always feel good after they've been cleaned, the long-term benefit of straight teeth is that less chance of periodontal disease, less chance of bone loss, less chance of losing.
I think
I love that figure, 63%. That's basically, 2 out of every 3
number.
And
this is easily treatable, right? Like if you're competent to do complex cases, that number will jump into nearly touching the 80s. So this is just cases that general dentists should be, bread and butter stuff that we can treat pretty easily with aligners.
Because the advancements in aligners, they've been around 20 years now. It's just phenomenal the what you can do with them. Originally using aligners was kind of like trying to move furniture with a pool cue. Very hard compared to braces, which just grab on and move. But now the technology of the attachments is really very scientific. The shape, the width and breadth of them, they're there for a reason and not just to something for the aligners to hang on to. 6 out of 10. How are you going in your practice? Obviously, being a flagship for CodeRead, because you're like the guy. This is company.
Exactly. This is an interesting thing, right? Where I was pretty much a solo practitioner with a couple of hygienists, and all of a sudden I've had to go to 0 day. Actually, I work 1 day a week still. It's not quite 0. So Monday is still sort of clinical day where I go in and see patients, put out the occasional fire. So essentially, David, what happened in 2023 when CodeRead got funding, I had to walk the walk, right? All of a sudden, the person that was running and making 80% of the money in this business is only there 1 day a week. So our revenue just pretty much fell off a cliff because when CodeRead took the money, the investors wanted me to come in pretty much full time onto the business. I could negotiate, keep me 1 day. And the story I said was using CodeRead and seeing patients and having skin in the game is beneficial for CodeRead. Hence, it's a good use of your investor money to let me work 1 day a week. Partially the motivator was to make sure my practice doesn't die overnight. But either way, I had to essentially grow the practice from near 0 revenue. And none of the patients wanted to see anybody else. I've been seeing them for 7 years. And so all of a sudden I had to create systems to keep the practice essentially running without me. So there was obviously there's this non-technical stuff, training the staff to, perform without me, hiring a few, competent dentists. So eventually I decided to hire 3 people part-time to take my load. So that's the sort of I think non-technical stuff. But essentially after that, I had to use technology and systems and make the most of my one day there to make sure these systems were running well. So the business is profitable again, and this time like without me, right? And we're nearly making the same amount of revenue without me, with just working one day than when I was working full time. And that's just happened in 2 years, right? So from 2023, 24, 25. So I think that's my biggest win of implementing co-treat, and I guess like changing my own mindset. I can't say it's all co-treat, right? Like, thinking that, okay, I'm only there one day a week. I have to make this work somehow, make sure the staff stays, make sure the patients are looked after, and make sure the business makes a buck. So I think that's the biggest win that I've achieved for myself, is get the practice running pretty much without me and profitably.
That's a great piece of information for any dentist with associates, because really that's always their concern. The principal dentist is the one who has the vision and sees it, and the people want to see. And sometimes the associates are only there because sometimes they're part-time and they just have a part-time attitude to
Yes.
diagnosis, presentation, and treatment.
And the more I've sort of looked into this, and now that we've got so many customers and just looking at my own practice, the more empathy I do have for the dentist. Like, we are so under pressure, David. Like, patients are, like the demand that the patients have is greater than ever. If you sort of like think about medicine, right? Like, there's a radiologist, there are physicians, there are surgeons, but in dentistry, it's us. Like, we got to do all of these things, as well as be a psychologist or a counselor to handle anxiety, as well as be aware of the staff and what's happening there. So like, there's just so much on our plate, right? Like, so when we're sort of like not meeting revenue goals or targets, like, I think there are understandable reasons. And I think as a practice owner, you want to support this super overwhelmed, overburdened, like our mental health and stress levels are pretty high, right? Like, still, and they've been pretty much top of the for ages. So I think rather than say, work harder, work more productively, I think we just got to have systems to support the dentist. And that's both the team, like treatment coordinators, front desk team, that can take certain tasks off the dentist, but ultimately, it should give, like the teamwork thing, rather than be reliant on the dentist to do everything and make all the money. Let's just spread that across the team and use tech to support the team.
I think the tech's really, really important, Max. You mentioned right at the start that, 3 dentists can give 3 different diagnoses and treatment plans for the same patient, and all are valid depending on what's in the mind of the dentist and what the patient is willing to accept as well. And it doesn't happen in medicine. If you're having a heart attack, the ambulance guy doesn't turn up and say, all right, well, here's your options, Mr. Patient. We can wait, see if the pain goes away. We can tell you to not do anything strenuous and put strain on that heart, and then everything will be okay. That's the equivalent of saying don't chew on that tooth, and all these things that are used in dentistry, but in the health profession are invalid. And most people would just say, look, just get me to the hospital, cut me open and fix me. Same with a hole in your roof. The roof.
One of my friends articulated this really nicely. He said that like the diagnosis shouldn't be subjective or multiple, like everybody should agree that there is a correct diagnosis or not. Like, is it stage 4 bone loss or is it not? Is it, RA5 carious lesion or is it not? So I think there is such a thing as a correct answer for diagnosis, but I think what the subjectivity and like swimming between the flags, that's for the treatment plan. This is the dentist's decision around how to manage this diagnosis. So I think we've got to draw essentially like a line in the sand. Diagnosis should be fairly objective. And I think there should be such a thing as truth and the correct thing for the diagnosis. Whereas a treatment plan, I think this is the art of dentistry and communication and getting the patient's desires and their massive, medical history or whatever else. The treatment plan, I think, has to be a collaborative effort. And I think that it's fine to have subjectivity and variations in the treatment plan.
Yeah. Sadly, I think for dentists, Max, and we're getting away from co-treat, but sadly, there's a perception from a lot of dentists that if they present something that could be expensive to their patient is not going to like them, and so their patient is going to leave. But it's not in the best interest of the patient not to have the treatment, and that's a scary thing.
Here's a question for you. What do you think about the idea of the dentist not talking money at all? So they become the physician and the person that does the diagnosis and proposes the treatment. They're the medical expert. I'm here to care for you. And another person in the practice, like a treatment coordinator, being the person that talks about money. What do
I
you think of that model?
I think every dentist needs to know the price, but
Mm,
doesn't need to be the salesman of the item. And so the
mm.
way I used to present it, Max. Now you're interviewing me.
I'm just genuinely curious about your answer.
Well, in my practice, depending on the gender of the patient in the chair, I would say to them, this is the same treatment that I would recommend for my father, my brother, my nephew. All right. And so I'm distancing. I wouldn't say my daughter or my wife. I think that gets a bit creepy, but
Mm,
I'm just making it a close relative. This is the treatment that I would recommend for them. And so I've gone generation up, same generation below. And patients love that because they then trust that this is what you're offering them, best treatment. And
yes.
behind that, for those words, is the fact that I tell you've got to talk to every patient as if dentistry is free and you can do whatever you want, or
Mm,
they are a multi and they can afford and are ready to get whatever they need. That's how you've got to
mm,
present your dentistry. You've got to present best treatment always and then come back from that. But if you start low, you know, I took over a practice. I had a practice gifted to me, Max, that a neighbouring practice in Parramatta was closing down. The guy was retiring and he couldn't sell it. And he said, look, here's my filing cabinet. I'll get my phone connected to your practice. Just look after them. I said, what do you want for this? He's nothing. I tell you, Max, he was the specialist patchodontist. He did not do
mm,
any posterior ceramics at all. And a lot of these patients, a number of these patients wanted their teeth fixed. In fact, I remember one guy saying to me, he said, I never thought that I could chew the way I can chew now that you've fixed all my back teeth. So this guy was missing
mm,
that opportunity of giving those
mm,
people best treatment because
mm,
whatever reason, he just thought that they just wanted patches or that they would not like him if he told them that they needed, a crown to
mm.
hold their teeth together. But that was that generation too. I think that was a phase in time. The baby boomers are now getting older and older and older, and the decay of the pre-fluoride baby boomers isn't present in the Gen X, Gen Ys,
And
and the millennials.
and again, I think that's why aligners and things like that, whitening is incredibly important to not miss anymore. Like if you think about it from a population health perspective, over the next 10 to 20 years, what's going to be the sort of like growth areas for what are the verticals in dentistry that's going to grow? And in my view, it's really going to be aligners is going to be number one. And potentially other, hopefully minimally invasive aesthetic treatments, things that patients actually want. Implants, I think, will be very popular, especially as the boomers age further. They're going to keep losing teeth. They're going to have the money to get a bunch of implants. So I think implants will absolutely be a good growth area for the next like 20 to 30 years. But yeah, I think orthodontics and aesthetic treatments, we just have to take very seriously as part of our businesses.
Well, absolutely, because the boomers aren't needing aligners because they've got a lot of missing teeth anyway. They're the ones who are really needing implants or something even more
Exactly.
substantial. It's tricky looking at times, but just in what I just did a calculation while you were saying there, the youngest baby boomer is now 61. So
Mm,
they're getting close to retirement and also
mm,
being on a fixed budget when they retire because they're either on a pension or they're on their superannuation. They're not really on a growth income anymore or not still working. Again, that's a missed opportunity. And the other thing about the boomers, Max, is that at the peak of the baby boom, it was 3.5 children per woman, right? And now it's less than 2, which is
mm.
that's negative population growth.
So it's a
Three and a
less
half
less
per
than
woman. So
replacement. Yeah.
it's not just it's not just an 18-year period. It's an 18-year period with a massive mountain in the middle of it, and that is what moved through time, creating those trends. Not just in health, but, property and a whole pile of things beforehand. Other issues in society that they've helped make. And I don't know whether just dividing them and say, oh, you're a millennial, you're a Gen X or a Gen Y or a Gen Z. That's just an arbitrary thing. But the baby boom really was. It was what
Mm,
caused it. Soldiers come home from the Second World War. What ended it? Birth control pill.
mm,
It wasn't just like arbitrary measurement. And I think the opportunity a big opportunity in dentistry for the baby boomers is gone because they are now all in retirement. And so
Mm.
like looking at the next lot of people coming through who are keeping their teeth and have smaller mouths, smaller bone structures because of mouth breathing issues, they do need straight teeth. They do. And they do also have snoring issues too and sleep issues as well as a
Mm.
result of lack of oxygen. There's a whole opportunity for tech. And one of the other things that I'm seeing, Max, in tech is also saliva analysis
Mm.
and tests. Again, that's looking at people's health, much like when you go to the doctor and he weighs you and he takes your blood pressure and he's seeing what's going on. Dentists traditionally have just gone in and looked for decay and cracked teeth and malocclusions, and they're treating illnesses and they're doing repairs, whereas saliva is showing you, what's going on in your body as well as in your mouth. We're trying to get the tech to merge dental as being a window to the body as opposed to being
Mm.
an attachment, that is separate from the body, which had been thought of for so long. It's an amazing world. It's changing all the time. But I keep coming back to the fact that how excited I am at what you're doing with Co-Treat and how that is really helping the dentist who's not really skilled in how to help patients get to that decision of having the treatment, that the Co-Treat is now a real advantage because it puts it in the hands of the patient in a way that they can understand and a way that they can come back to the dentist and say,
I,
hey, I like this. Tell me more about this bit. Tell me more about that bit
I,
that I've been
I
playing
I
with.
think also the practice owner, David, like the way I think about it, I consider 4 key stakeholders. Patient is always, serve the customer, they'll look after everything else, right? So the patient and then the dentist, then the practice owner, and then the treatment coordinator / the front desk person that has to handle some of the sending and comms tasks, right? So the more I get into this journey and look at the behaviors of our customers, right? The more I think this is a very, very important tool for the practice owner. So to look at their practice as a system, right? Like let's say you got four surgeries, now you have visibility into what are the opportunities of the patients that are coming into all these 4 surgeries. And then you can sort of like move your chess pieces around properly. So for example, dentist A loves aligners, does not know implants, cannot do implants, and then vice versa, right? So essentially, you want to utilize the expertise and the preferences of these different dentists. The patients have the same needs. You want to identify all the opportunities and then essentially like move the patient to the correct person to maximize, like, I don't like the word, but patient yield, right? You want to make sure all the issues are addressed, not necessarily by the one person, but whoever can do it. That's a win for the practice. So yeah, I think support the dentist, empower the patient, but like give a good system for the practice owner. That's what we're trying to do.
Well, you're right. Not only are these tools great for the dentist in helping the patient understand the treatment, but they're also great for the treatment coordinator, the front office in making sure that the patients keep their appointments and then making sure the patients make their appointments to get the work
Exactly
done.
right. Give the reason why, right? Like what is a compelling reason you need to book this next appointment, whatever that is.
Yeah, and patients we know in our practice, Max, we get up and walk out of our treatment room and they'll turn to the dental assistant and say,
Mm,
do I really need what he said? They'll ask that.
right.
And so your dental assistants need to be able to exactly on cue say what, I used to love it when patients would come out and ask Jane, do I really need this? And she'd go, yeah, bang, bang, bang. And they go, that's exactly what he said. That's
Exactly.
what, that having the tech there is.
Exactly. The AI can support the dental assistant or the front desk person,
Mm,
right? So
mm.
instead of just looking at the dentist notes and trying to read a bunch of notes to understand or a bunch of item codes, just click on the Co-Treat file and the AI will have said, this patient has orthodontics, indirect restorations. These teeth are fragile. So at a very quick glance, the DAs and the receptionists can continue the same story and the same communication. Everybody's singing from the same hymn sheet.
Yeah, and I think that what you're going to find is that this, I'm just thinking off the top of my head, that this is actually going to be a great assistance for the privately owned practice to keep up with the bigger organizations who won't be using this sort of thing in their offices, I don't think. I think often it's the same when NRMA was opening its own repair shops as well as insuring cars. All of a sudden, a conflict of interest. Why am I going to repair this car with more expensive parts if we're paying for it because we're the insurer as well as the provider? And so sometimes we have that that dilemma in the dental world as well, where insurers are now being the providers. Anyway, the point is that we need to make sure that the gap between private practice and large organisations doesn't become a chasm. Private practice will always be around. There'll always be people who want to come to those practices, but they have to be viable. Otherwise, they go under, and we lose good relationships with our patients.
In terms of like a competitive advantage for the small and medium businesses, I think it's our agility and it's our ability to be like nimble and adopt new technology, trial things. Whereas these massive organizations, they're like big ships that have to turn, right? They can't adapt and rapidly roll out new technology or innovations or, experiments in patient experience, whatever it is you're trying to improve. I think I would highly advise like small business owners to be more agile and experiment with these little things, because that's a competitive advantage compared to the larger orgs that you've spoken about.
Yeah, it's tricky. I did hear somebody tell me that the small guy has real trouble equipping a practice with all the tech now that's available, whereas the big organizations is just they write a check for multiples. And also, I do know that in startups in America, they just can't compete. Whatever the rent or the site costs of setting something up, the small guy just can't compete, and so very hard for the small guy to get a good greenfield site anymore. That's
no, it's
it's turbulent times in private practice, but people still will seek out the private practice, Max. They still are looking
patients. Absolutely, they're looking for community and a face that they can be with them for long term. Just on the earlier point, like I think CapEx is obviously really difficult, but the beauty of software is like our Cotery's like smallest package starts at $300 and there's no lock-in contract, right? So it's not a difficult experiment to, risk $300, see if it fits for your practice. And there's many other startups and softwares in Australia alone, right? Like Cotery's one startup, software startup that plays in dental. There are many others. So I think these small and medium businesses can just see what fits in their practice and does it add value. And these are not little experiments that the big guys can conduct rapidly. Like they'll run a pilot for, say, 6 months or 12 months and then go through their governance boards and decide if it's a full rollout. Whereas a small business owner can say, yeah, let's do it tomorrow. Let's see what happens.
Big advantage. It's big advantage for you to be playing in that,
I think it's a win-win. It's great for us, and we love working with our SMB customers and adding value to their businesses. But also in terms of a competitive advantage for the customer, it's the ability to rapidly adopt and onboard and roll out these new innovations.
Excellent, Max. What's the best way for somebody to get in touch with you if they're interested in looking at CoTreat for their practice?
Just go to cotreat.ai. So that's COTREAT. It's a collaborative treatment. That's where the name stems from. So CoTreat is collaborative treatment. So cotreat.ai, and you can just fill out our form and book a Zoom meeting with one of the team, and we can show you what the platform does.
Excellent. Easy as that. So no email address, just straight to CoTreat AI. Fill in the form and Max's team will be in touch with you virtually immediately. Excellent. Max, thanks for being a guest today on the Ultimate Dental Podcast. Really appreciate your time.
Oh, David, thank you for having me. I've actually really enjoyed this conversation. Thank you.
Oh, thanks, Max.
Thank you for tuning in to another inspiring episode of the Ultimate Dental Podcast. We appreciate each and every one of you for being part of our dental community and joining us each week on this incredible journey. If you found value in today's episode and you don't want to miss out on future episodes packed with expert insights and actionable strategies, here's how you can stay connected with us. Firstly, hit that subscribe button. Whether you're listening on your favourite podcast platform or watching on our website, subscribing ensures you'll never miss an episode. Secondly, share the love. If you know a fellow dentist or colleague who could benefit from the wisdom and knowledge that we share here, please share our podcast with them. Also, please share the podcast on your socials by simply clicking on the social icons wherever you view or listen to this podcast. Together, we can all do our bit to elevate the dental profession. And finally, stay engaged with us. We love hearing from you. Your questions, comments, and feedback fuel our mission to provide the best content for your professional growth, your personal growth, and for your practice growth. Remember, your journey to creating a dental practice and a business life that you love is our mission, and we're excited to be your trusted guide along the way. Thank you for being a part of the Ultimate Dental Podcast. Until next time, keep smiling, keep strong.